My name is Kasaya. I'll be your nurse today. Can you give me your name and date of birth?
Emma K. 012894.
Do you know why you're here today?
Yeah, I have pain and swelling in my knees for the past 2 weeks. It usually gets worse in the afternoon.
Okay, have you done anything to relieve the pain?
Just a little bit of stretching.
Okay. And you said it's on your left leg? Left knee?
Mm-hmm.
Can I see your knee, please? Oh, sorry, does it hurt when I touch it?
It hurts.
So I saw in the doctor's orders that you are receiving a medication called Rheumatrex, which the generic name is also Rheumatrex, and it's supposed to suppress the immune response that are killing by killing B and T lymphocytes. And the end result of what we hope to see is the decreasing of joint swelling and the pain from your rheumatoid arthritis. Have you ever taken this medication before?
No.
Okay, so some of the side effects when you are taking this medication would be nausea and vomiting, which is common. The more serious side effects, which is also called adverse reactions, would be something like Stevens-Johnson syndrome, pulmonary fibrosis, toxic in your liver, and GI ulceration. So if you're experiencing a rash that may indicate Stevens-Johnson syndrome, you would have to notify me, and that would mean that we would have to discontinue the drug.
Yeah, so in our culture it's common for women to have a lot of kids, and Emma still hasn't had any kids yet, so I was wondering what's her options?
May I ask first, are you pregnant or breastfeeding?
No.
Okay. Well, taking this medication is considered as category X, so which means this may be harmful for the child. So one of your options may be adoption or a surrogate or freezing your eggs, because one of the risk factors of taking this medication is also infertility. So you may have to consider that beforehand. Before we give you the medication, is it okay if I do a pregnancy test?
Yes.
Okay.
Yeah, so I just have another question. In our culture we use the herb yukinaki a lot, and I was wondering if this it's okay to take this herb with this medication?
No, it's not okay, because the herb may interact with the patient's immune system while taking this medication. You're also not allowed to take NSAIDs and caffeine while you're on this therapy.
Okay.
Okay.
Can I take aspirin?
No, you can't take aspirin because it's an NSAID, and it's also considered a blood thinner, so it will increase your chances of bleeding. So I checked your pregnancy test, and it came out negative. And I also checked your lab values, such as ALT, AST, bilirubin, BUN, and creatinine, and it's all within normal limits. Okay, MK for Rheumatrex. MK, Rheumatrex, 7.5 milligrams at 12 o'clock. Hello, I have your medication for Rheumatrex. Okay. MK, Rheumatrex, 7.5 milligrams at 12 o'clock. Hello, so I have your Rheumatrex here. Can I have your name and date of birth, please, to check to match with the MAR?
Emma K. 012894.
Okay. Before I give you this medication, I would just like to let you know that you are going to be taking glucoverin at 6 o'clock, and it's because Rheumatrex at high doses can be increased for toxicity. So leucovorin is just we're going to take it now to prevent you from the toxic symptoms.
Okay.
Okay. So do you have water with you?
Yeah.
Okay. So here you go. Hello, how are you? I'm Jane. I'm your physical therapist today. Can I just have your name and date of birth?
MK012894.
Okay, awesome. So I heard that you have some rheumatoid arthritis around your knees. How's your pain level today?
It's like a 3.
It's like a 3 out of 10?
Yes.
Okay. So from here, we're going to do some range of motion exercises. So can you just swing your legs over to the side? Okay, and can you just come up to the edge just a little bit more? Awesome. And from here, can you lift your legs up? Good. And bring it all the way back. As far as you can. Good. Okay, now we're going to do it against resistance. So I'm going to push on your legs. I want you to try and bring it high up as far as you can. Okay?
Okay, I'll try to swing you out.
Okay, try not to kick me. Good. And go all the way back. Excellent. Wow, you're very strong. Okay. So from here, we're going to try and walk in the hall. Okay, so that's going to help with the inflammation and the swelling and the pain. Okay? All right. So I have a cane for you, and that'll help with your walking. Okay? So first, what you want to do is move the cane forward, and then you want to move your non-injured leg first. And then the injured leg. Good. How is that?
Okay.
Okay, let's do a couple more steps. So first the cane. Good. And one more.
Come in.
Hi, so I have your discharge papers here. Are you able to read them?
No, I'm not wearing my glasses. I don't usually wear them.
Okay, so with Rheumatrex, it may cause blurry vision while you're on the drug, so I recommend that you start wearing your glasses again, and also going to an ophthalmologist to see if there's any progress or not in your vision. I also recommend that you also have a heart-healthy diet.
So, like eggs, fruit, vegetables, and nuts?
Mm-hmm.
Okay.
And do you like to exercise, or do you have any favorite activity you like to do?
I like to swim.
Swim? Okay, so swimming is good for the joints. It's very light and it's nothing too intense. So I recommend that you could swim or some sort of lightweight activity 3 times a week.
Okay.
Do you have any more questions?
No.
Okay. So here you go, or actually I'll give it to my sister. And good luck, and I hope you feel better.
Thank you.